Hello viewers. As many as 1 in 8 couples struggle with fertility problems. Many couples who postpone their family in order to concentrate on careers or jobs underestimate how difficult it is to have a baby later in life. Just the way we plan our finances and career, it is imperative to have a reproductive plan for the life. In this video, let us understand how aging affects fertility. I am Dr. Sumina Reddy, obstetrician, gynecologist, fertility specialist, and Laparoscopic Surgeon. So, how does age affect a woman's ability to become pregnant and sustain a pregnancy? A woman's age is one of the most important factors affecting whether she is able to conceive and give birth to a healthy child. This is due to several changes that are natural part of aging. The number and quality of eggs decreases naturally and progressively from the time a woman is born until the time she reaches menopause. This decline is gradual until her early 30s but accelerates quickly after her mid-30s. It is not only more difficult to get pregnant, but miscarriage and chromosomal abnormalities in the child, such as Down syndrome, more common in the older mothers. Fibroids, endometriosis, and medical diseases like hypertension, diabetes are more common in older women and can cause fertility problems. The women who become pregnant at an older age have a higher risk of complications during pregnancy, such as gestational diabetes and preeclampsia. Whereas in man, the decrease in fertility appears to occur later in life than in women's fertility. Usually in their mid to late 40s, men experience changes in their sperm quality that can cause issues with fertility and chromosomal developmental problems with the offsprings. So, when should you start asking questions? Couples where the woman is younger than 35 should go for fertility evaluation if they have not been able to conceive after 1 year of trying through unprotected sexual intercourse. Whereas, couples where the woman is older than 35 should seek evaluation if they have not been able to conceive after 6 months. What are the other factors that can cause decline in your fertility? If you have any of the following risk factors, you may consider seeking earlier advice. First, family history, that a mother or a sister with early menopause before the age of 45. Second, history of cigarette smoking in either of the partners. Third, any previous ovarian surgeries. Fourth, exposure to chemotherapy or radiation to treat cancer in either of the partners. Fifth, any history of injury to testicles in the male partner or exposure to toxic chemicals such as pesticides and etc. If a couple have an obvious medical problem affecting their fertility or affecting their ability to conceive, such as absence of periods or irregular periods, sexual dysfunction, when there is a history of pelvic disease or prior surgery, they should begin the infertility evaluation earlier. How can they test for your fertility? Ovarian reserve, that is the number and quality of your eggs, can be estimated by blood tests such as follicle stimulating hormone, anti-Mullerian hormone levels or AMH levels, and by ultrasound to count the number of antral follicles in your ovary. Whereas in a man, during semen analysis, the ejaculate is examined to measure the number, shape, and movement of the sperms. Is it possible to slow down or reverse reproductive aging? The answer is no. However, eating well, exercising regularly, getting enough sleep, avoiding smoking, and adopting a lifestyle that reduces stress can improve your overall health. However, despite our best efforts to slow down or reverse the process, improved health does not offset the natural age-related decline in fertility, which can take place much sooner than expected in most of the women. Therefore, it's important to talk about family planning with a healthcare provider, even if you're not thinking about getting pregnant right away. This might decrease the chance of having difficulties later in life. What are the other options available? Men and women who want to delay their childbearing until their late 30s or early 40s may consider methods to preserve their fertility. One good way to preserve your fertility is to freeze sperms or eggs or embryos. In men, semen collection is usually a quick, non-invasive and simple process, and cryopreservation of sperms is well established. A woman must undergo egg freezing if you do not have a partner, or embryo freezing if you have a partner. Thank you for listening. Keep listening, and if you like to know more about women's health and fertility, do not forget to like, share and subscribe to our channel. Thank you.